Okay, so you're in labor. Now what? At some point, you will need to notify your caregiver. Always ask them well in advance how you will get in touch, when you should, and after what has happened. Doctors here in Calgary work on a shared rotation basis, so you never know which one you will get. Most of the time, there is no phone number provided, and instructions are usually simply to head to the hospital, and the nurses there will check you out, decide if you're going to be admitted or sent back home, and notify the appropriate doctor. We do have the HealthLink number to call, 811, which puts you in touch with a registered nurse, but I'll save you about 15 minutes of time by telling you that likely upon hearing the words pregnant and possible labor, they'll tell you to go into your designated hospital no matter what. Midwives often work quite differently, where you actually have their cell phone number to call when labor signs show up. They will instruct you after talking through your symptoms and decide on a course of action. Again, establish well in advance with them what they prefer and what their policies are. The usual alert the caregiver symptoms include when your membranes rupture, also when contractions become about 5 minutes apart and last 1 minute long and have been that way for at least 1 hour, commonly referred to as the 5-1-1 rule. Second-time parents would probably head in sooner though, as labor usually progresses faster. Any higher risk situations would warrant a call to the midwife or a visit to the hospital at the first signs of labor, such as being GBS positive, having high blood pressure, attempting a VBAC, or any pre-existing medical conditions that require monitoring. Anytime symptoms start prior to 37 weeks, you should always go straight in case labor can be stopped to allow the baby to have more time to develop. Anytime you experience red flags like excessive blood loss, decreased fetal movements, a fever, or where it feels like the contraction never ends, head straight in. Some situations would require skipping the drive to the hospital altogether and calling 911. If you feel pressure in your bottom, like you need to have a bowel movement, or you feel yourself involuntarily bearing down, pushing with each contraction, or if you have large amounts of bright red bleeding, like quantities of a period or more, or if your water has broken and you can feel something in your vagina, which could possibly be the umbilical cord, just call 911 straight away. If you're in the situation that you have a midwife and feel the urge to push, give them a call first and to see how far away they are. They may be closer and faster than the paramedics arriving, and they can give you more specific instructions on what they'd like you to do. Above all, anytime you just have a feeling that something is not right, again, head straight in. The nurses in labor and delivery take these concerns seriously, and they will check everything out. You are not being a nuisance to them at all. If everything is fine, then you can go home and rest easy knowing all is well.